So today we're here in the Wells Fargo Historical Services Museum. Right here to my left is our stagecoach. I actually manage our stagecoach appearance program. I'd always been active and participated in sports, exercised in a gym, and that was all well and good. But then I started noticing that, for example, in the gym, I would work out 90 minutes in the mornings and just couldn't do it. 90 became 60, became 30, became 20. So I figured that maybe it was just I'm getting older and this is what happens to everyone.
So my first grant was an AHA Postdoctoral Research Fellowship Award that I obtained when I was a fellow. This was a randomized, double-blind, placebo-controlled trial of a diabetes medicine called pioglitazone. And we tested this drug in heart transplant patients to see whether it could prevent chronic rejection. So we did a randomized clinical trial of pioglitazone versus placebo or sugar pills to see if patients who receive this medication have less insulin resistance and less inflammation. And it really solidified my desire to pursue further training in clinical research and to pursue clinical research as a career pathway. This wall depicts the initial period that launched the field of heart transplantation, but there's still so much more work to be done. So we are continuing that tradition of innovative research in the field of heart transplantation here at Stanford.
I was really fortunate. I actually applied for and got a grant for young investigators in high school. Now, I honestly got to tell you, I didn't know what that was going to mean and how that would really change the rest of my life. Now, I ended up going to UCLA because I had such a great experience through my Heart Association grant in the lab at UCLA. I ended up doing research during medical school. That research actually allowed me to graduate with honors, and my honors project ended up being research in surgery. The project that we worked on, that was my honors thesis for medical school, ended up being what currently bariatric surgery is.
The very first grant I got, right outside of a fellowship, was American Heart, to help me develop an animal model of congenital heart disease that induces pulmonary hypertension. The anesthesiologists were interested in delivering nitric oxide as a gas to patients. We, Mass General and 2 other centers, started the first randomized trial of delivering inhaled nitric oxide to newborns with what's called persistent pulmonary hypertension. There were then subsequently many other studies that led to the FDA approving this drug, which is now the mainstay of therapy for all acute pulmonary hypertensive disorders.
When I got the response from the American Heart, I was ecstatic and also truly honored because I know how competitive it is. And for my science to have received that recognition almost felt like an award. This current grant is focused on acute lung injury, and we're looking at vascular cells to try to understand the vascular biology of acute lung injury in the setting of diseases like sepsis is the goal of the grant. And so we're focused on potentially targeting integrin alpha V beta 5 as a therapeutic target. The disease of sepsis is actually the #1 cause of mortality in many hospitals, including UCSF. And so it's really an unmet need, finding new treatments for sepsis. Heart transplant patients are more likely to get it because they're placed on immunosuppression so they don't reject the heart. So immunosuppressed patients, also like cancer patients who are on chemotherapy, are more likely to get sepsis.
I can tell you that my connection with the Heart Association was solidified with that original grant. It got me thinking about the bigger picture, not only about that research I did that summer, it created a long-term attachment to prevention of heart disease. And I see my role now is to really get people to see that connection between research and what's going to happen when they themselves or a loved one is in the hospital with heart disease or stroke.
I do remember when I asked, the doctor told me, well, it looks like you're going to need a heart transplant. I kind of smiled and said, yeah, what, 10, 15 years, 20 years from now, or something like that. And he said, oh no, Mr. Law, it's much, much sooner than that. And I remember going outside of the hospital and just kind of like being stunned. Your first concern is always for your family and what life would be without me. And I experienced that to some extent because my mother passed away when I was 13 years old. So I didn't want that to happen to my boys.
So we have such close relationships with our patients like Levester to really find out what their needs are and respond to their needs, and then go back to our labs or our computers and do our research to really help make their lives better.
My life now is normal again. I feel and think a lot deeper about things because of what I've gone through in my journey. And I'd like to think that I'm a better person as a result, and honestly, I'm not sure that I would change that.
Within the field of pulmonary hypertension, which the American Heart Association has been very supportive of, I mean, we went from absolutely no hope, the possibility of a lung transplant, but in small babies that's still not a possibility, to 12 therapies, and kids are doing much, much better. The concept of a cure was never thought of, and now we're actually seeing kids where their vasculature normalizes. There's still a lot to be done here, but the field has moved exponentially in terms of long-term survival, that it's been incredibly gratifying.
You always just have to look at the next step and keep applying for the next grants, and that's something that as scientists, all of us spend a lot of time and effort doing.
I think the American Heart Association has been very innovative, and they're really willing to fund what I think are high-risk but high-reward type grants, and they'll think outside the box a little bit.
Well, we're at a really difficult time in terms of funding. Research funding at the national level has not increased in about 15 years in real terms. And so it's really important to support scientists at every level.
Keep doing what you're doing. Keep pushing, keep pressing, keep finding answers, keep finding solutions, because you are saving lives. Not everybody can say that. You are saving lives.